Have you ever wondered whether your body might be giving you quiet signals that you're simply missing? What if a slight shift in your usual scent could actually be a clue pointing to a life-threatening illness like cancer? It might seem surprising, but our bodies regularly give us hints, and ignoring them can cost valuable time. Cancer, among the most feared diseases worldwide, doesn't always arrive with clear, noticeable signs. In fact, some of its earliest warning flags can show up through changes in your body's smell, whether that's on your breath, in your sweat, or in your overall odor. Think of these scents as gentle alerts, quietly suggesting something might be off. Would you recognize them if they appeared? In this video, we'll be discussing 8 specific odors linked to cancer that people often overlook. Identifying these signals early could be crucial for diagnosing the disease while it's still treatable, potentially saving a life, so be sure to stick around until the end. Let's begin. You might be asking, how can cancer affect body odor? The secret lies in the way cancer disrupts ordinary bodily functions. It commonly causes minor yet key metabolic changes, producing specialized compounds called volatile organic compounds that can alter your normal scent, whether from your breath, sweat, or urine. Studies have shown that some cancers, such as lung, skin, and bladder cancer, emit unique chemical markers that can change a person's body odor. Although these markers might be too faint for most people, trained animals, particularly dogs, can detect them astonishingly well, sometimes before medical tests can. Scientists are also developing electronic noses, devices designed to replicate a dog's keen sense of smell. Imagine a test that could diagnose cancer by reading a sample of your breath or sweat. Until that technology becomes widespread, paying attention to your body's signals remains crucial. A recurring, inexplicable smell, one that sticks around, may be more than a mere oddity. It could be your body's way of nudging you to take action. Overlooking subtle signs like these might cause you to miss the most advantageous window for early intervention and treatment, when survival rates are at their highest. At first, it might seem surprising to think certain odors could clue you into cancer, but this idea is well supported by science. The human body constantly sends out signals, sometimes through symptoms you see or feel, and sometimes through changing odors you might not notice. Recognizing these faint scents early could be life-saving. So how can you know if something's amiss? Which smells should you watch out for? In the rest of this video, we'll explore the 8 most common odors that might act as early indicators for various cancers. By learning about these subtle changes and staying vigilant, you'll be better prepared to act quickly, potentially making all the difference. Let's investigate these signals together, because early detection is so important, and your health matters too much to ignore. Number 1. The hidden mold, a mouth and throat cancer warning. Mouth or throat cancer can be tricky to spot early on, but there's an unexpected clue people rarely talk about: a musty odor that smells like mold or rotting wood. This odd smell can come from infections, tissue damage, and certain chemicals released by growing tumors in the mouth or throat. As the cancer progresses, these substances build up, creating a distinct odor you might notice when someone speaks. Sadly, it's often mistaken for poor oral hygiene or minor dental issues, delaying the medical help that's urgently needed. This musty smell may also be paired with persistent hoarseness, difficulty swallowing, non-healing sores in the mouth or throat, white or red spots, and even ear pain that has no obvious cause. If you sense this odor along with any of these symptoms, it's crucial to see a specialist, like an ENT doctor or an oncologist, right away. Early detection greatly improves the odds of successful treatment, so never ignore lingering changes in your breath or any other concerning signs. Number 2. The rotting smell, a sign of colorectal cancer. Colorectal cancer is one of the top causes of cancer-related deaths worldwide, but its early warning signs are often passed off as everyday stomach problems. One such red flag is a distinct change in the smell of your stool. When cancer in the colon or rectum messes with digestion, it can release toxins and gases that alter the normal odor, often giving off a scent reminiscent of rotting matter. Although the smell of stool can vary based on what you eat or any medications you take, A persistent, unexplained decaying smell should raise concerns. Additional symptoms may include blood in the stool, ongoing belly pain, shifts in your bowel habits, or sudden weight loss. Because many of colorectal cancer's symptoms don't emerge until the disease is well underway, detecting an odd odor could be one of your only early clues. If you notice a consistent change in the smell of your stool, see a doctor. Procedures like colonoscopies, stool analyses, or imaging tests can uncover issues early, and catching colorectal cancer promptly boosts the likelihood of a cure. Number 3. The sweet smell that warns of breast cancer. Breast cancer, which mostly affects women, though it can occur in men, sometimes appears with an unusual sign, a sweet but unpleasant smell coming from the skin or from sores linked to the tumor. This odor is typically found in more advanced stages, when the fast-growing cancer cells cause infections or tissue breakdown that release these distinct chemicals. Often, open wounds or ulcers on the breast produce this sweet odor. Although it might be mistaken for a minor infection or poor hygiene, its persistence indicates a more serious concern. Along with the odor, you may also notice other signs like lumps in the breast or armpits, changes in skin texture or color, odd nipple discharge, or long-lasting pain in that area. When these symptoms appear together, seek medical help right away. Discovering breast cancer early greatly boosts the effectiveness of treatment. Recognizing the clues from this sweet smell could be the key to catching the disease early, rather than facing a more advanced and challenging scenario. Number 4. Sulfuric breath, a warning of stomach cancer. Stomach cancer is a sneaky disease that often shows up with subtle symptoms easy to dismiss. One early warning sign is a lingering sulfuric or rotten egg smell on your breath. This odor occurs because the cancer disrupts digestion, causing sulfur gases to form in the digestive tract. Unlike ordinary bad breath, a sulfur smell won't go away with better oral hygiene or dietary tweaks. It persists, signaling that something's not right. You might also notice stomach pain, feeling constantly full, loss of appetite, frequent nausea, or in more serious situations, blood in the stool or vomit. Because gastric cancer symptoms can mimic harmless issues like acid reflux or gastritis, this unusual sulfuric odor could be one of the few early clues you get. If you notice this smell alongside other digestive problems, it's vital to see a gastroenterologist right away. Early detection leads to more effective treatments and greatly improves survival chances when it comes to gastric cancer. Number 5. The rotting smell of melanoma, a skin cancer warning. Melanoma, a severe type of skin cancer, is among the deadliest. One surprising sign is an odor that smells like rotting flesh or decay. This happens because cancer cells start to die off, releasing chemicals that create a bad smell. Any open wounds or stubborn skin sores, especially in areas you can't easily see like your back or scalp, may give off this odor. Although it's sometimes confused with things like poor hygiene or minor infections, a strong, persistent smell, particularly if you also notice changes in moles or spots, should never be overlooked. Other signs include fast changes in a spot's color, texture, or size, bleeding, and ongoing pain. Because melanoma is extremely aggressive, catching it early is vital for successful treatment and higher survival odds. Number 6. An ammonia warning in urine. A kidney cancer alert. Kidney cancer can develop quietly, and one of its rare but telling signs is a strong ammonia-like odor in your urine. This smell surfaces when kidneys, normally filtering out toxins, begin to fail because of cancer, resulting in a buildup of chemical byproducts. Not every ammonia smell points to cancer, though. It can also stem from urinary tract infections, dehydration, or a high-protein diet. However, if the odor persists and is paired with back pain, blood in the urine, extreme fatigue, or unexplained weight loss, it's essential to see a doctor right away. Early detection of kidney cancer greatly boosts your chances of successful treatment. Number 7. A metallic scent, a blood cancer alert. A metallic odor is another unexpected sign that could point to a serious condition like blood cancer. People with leukemia or lymphoma often notice a metallic smell in their breath or sweat, which arises because cancer disrupts the normal production or breakdown of healthy cells. This disruption changes iron levels and other chemicals in the blood, creating a scent similar to rusty iron or old coins. The smell tends to show up during periods of heavy sweating or even mild activity. Although this sign is subjective and easy to mistake for environmental or dietary factors, its persistence, particularly if accompanied by extreme fatigue, recurring fevers, frequent infections, or unexplained weight loss, warrants prompt medical attention. As with most cancers, early diagnosis is crucial in leukemia and lymphoma, significantly improving treatment outcomes. Number 8. A sweet, fruity smell. Lung cancer's hidden warning. Lung cancer is especially dangerous because it can develop quietly for a long time. In some cases, one of the first signs is a slightly sweet, fruity odor on the breath, caused by volatile organic compounds released in the lungs when cancer cells change how they process energy. Although this smell is similar to that of fermented or spoiled fruit, it won't vanish with ordinary oral hygiene and tends to linger. Sadly, such a subtle sign is often mistaken for common digestive issues or even diabetes. Additional symptoms might include a lasting cough, trouble breathing, tightness in the chest, or chest pain. If these signs appear alongside this unusual sweet smell on the breath, it's critical to see a doctor right away. Finding lung cancer early is vital for successful treatment and higher survival odds. Imagine that something as subtle as a smell could be your first clue to a serious illness. Our bodies are amazing at sending signals, sometimes through clear symptoms, other times through quiet changes in odor. Even if these changes seem insignificant, paying attention could save your life. Early detection is one of our most powerful defenses against cancer, so responding quickly gives you more time, more treatment options, and a better chance to overcome the disease. Don't dismiss recurring or odd smells or any persistent symptoms. Every moment counts, and your health is worth the effort. If you or someone close to you experiences any of the signs we've discussed, please seek medical help right away. Acting now is a gift to yourself and the people who love you. Life is too precious not to take these signals seriously. Remember, your body is always speaking. It's up to you to listen. Will you heed these warnings, or let them slip by unnoticed? The time to act is now. If you found this video helpful, give it a thumbs up, share it with others, and subscribe for more health tips and life-saving information. Together, we can raise awareness and help more people take charge of their health. Stay informed, stay healthy, and see you next time.